Are we willing to climb a tree for a fresh perspective? If we can lock eyes with Christ, Christ will lock eyes with us. He has never stopped loving us, even when we have stopped loving ourselves. This is our Christ. And it wasn't so much what the old man said to our bench sitter. It was meeting someone who assured him that his pain was a shared pain, that everyone goes through the hurt he was feeling. This is our church, our Christ, and our church. When we look for them, we find the gifts of God everywhere. For Ancient Faith Radio, this is Father John Oliver.
You've been listening to the Hearts and Minds podcast. Father John Oliver is the priest at St. Elizabeth the New Martyr Orthodox Church in Murfreesboro, Tennessee, and the author of Touching Heaven, Finding God on the Island of Valum, published by Conciliar Press. This has been a listener-supported presentation of Ancient Faith Radio on the web at ancientfaith.com.
The Ancient Faith for the Modern World. This is Ancient Faith Radio.
Welcome to Live with the Lows with your hosts, Father Nicholas and Dr. Roxanne Lowe, where we will connect our Orthodox faith to day-to-day living and relationships to our family, our work, and our view of ourselves. Father Nicholas is the priest at St. John the Divine Greek Orthodox Church in Jacksonville, and Dr. Roxanne is a licensed clinical psychologist who uses her extensive training in private practice. Questions are welcome by calling 855-237-2346. That's 855-237-2346. Here now is Father Nicholas and Dr. Roxanne.
Well, good evening, everyone, and welcome to Live with the Lows. My name is Father Nicholas Lowe, and I'm joined by my lovely wife and co-host, Dr. Roxanne Lowe.
Good evening, everyone.
We are so excited that you're joining us. Roxanne is a clinical psychologist. And, we started this show several years ago, Live with the Lows, with the hopes to give you some practical steps to help you grow in your walk of faith. Practical steps that merge both faith and psychology together to give you just some guiding principles to live by. We broadcast this show every single Tuesday right here from Jacksonville, Florida, from 8 to 9 p.m. Eastern Time. So if you're new to listening to Live with the Lows, thank you so much for joining us. Before we dive into tonight's really important topic, we do want to encourage you to stay connected to us by joining all of our social media platforms. We're on Facebook, Twitter, Instagram, and YouTube, and they're all under the headings of The Lows. And our last name is spelled quite uniquely. It's spelled Louhs. It's The Lows. In fact, our show is currently being broadcast on our Lows Facebook page, as well as on Ancient Faith Ministries Facebook page. And if you're listening to our show tonight and you'd like to receive our daily words of encouragement, so many people over the last year since we started to do these have subscribed to this. And if you're one that's just looking for some words of encouragement and inspiration, or if you know someone who may be in need of some encouragement and inspiration, tell them to go to our website at thelows.com and click on the subscribe button. There's no strings attached. All they have to simply do is put their email address in, and every day they'll receive a daily word of inspiration from the two of us. So many people are also receiving these messages, and they tell us time and time again how beneficial they are and how practical they are. So once again, if you're interested, go to thelows.com and click on that subscribe button. We also wanted to once again remind you about our book, Renewing You, A Priest, a Psychologist, and a Plan. Great Lent is just a few weeks away, and if you're looking for some renewal, a prominent theme during the season of Great Lent, then consider Renewing You. You can find it here at Ancient Faith at store.ancientfaith.com. There's also available an audible version that Roxanne and I both recorded in our own voices. And again, all of the proceeds from this book go to outreach ministries that are very passionate to both Roxanne and I in our ministry. So definitely, if you're looking for a gift or you're looking for some renewal in your life, definitely take a look at our book, Renewing You. And before we begin tonight's show, I also want to once again invite all of you to join the conversation. You know, friends, we're strong believers that growth happens in a conversation. And so tonight is definitely one show that you definitely want to call into to speak with our special guest. You can call in at 1-855-237-2346. That's 1-855-237-2346. You can also email us a question at ask@ancientfaith.com. That's ask@ancientfaith.com. And as we mentioned earlier, we are being broadcast live on our social media platforms on Facebook, under the Lowe's, as well as on Ancient Faith Ministries. So let's get started. Friends, we want to talk to you today about stress and the human heart. You know, the Bible and Christ have a lot to say about the power of the human heart. Listen to some of these verses. In the book of Proverbs, chapter 4, verses 23, it says this: above all else, guard your heart, for everything you do flows from it. In another verse in the book of Proverbs, it says, trust in the Lord with all your heart and lean not on your own understanding. Or even in the New Testament, in the book of Philippians, it says, and the peace of God, which transcends all understanding, now listen to this, will guard your hearts and your minds in Christ Jesus. Friends, God is not quiet about the power of the human heart, how it can impact us spiritually, and that without taking care of it spiritually, it can lead us away from God and living an unhealthy spiritual life. But it's no different also physically. Our heart is the lifeblood of our bodies. Without taking care of it, we too can live an unhealthy life. And sadly today, one of the leading causes of death in this world is heart disease. February is Heart Healthy Month. And so we thought tonight we would speak to a dear friend of ours and a world-renowned cardiologist, Dr. Roxana Mehran. Let me tell you a little bit about her. Dr. Roxana Mehran is a professor in cardiovascular clinical research and outcomes. She's also a professor of medicine and population health science and policy at the Icahn School of Medicine at Mount Sinai. She is an internationally renowned interventional cardiologist and clinical research expert in the field of cardiovascular disease. She's truly amazing. She has built a globally respected academic research center. She's a current member of the American College of Cardiology Board of Trustees and is a chief scientific officer of the BAIM Institute. She has been included for 4 consecutive years in the Clarivate Analytics, the most cited researchers, the top 1%, as well as being included in the world's most influential scientific minds. Dr. Mehran is also a recipient of several awards, including the 2016 American College of Cardiology Bernardine Healy Leadership and CV Cardiovascular Disease Award, the 2018 Annette Wegner Award for Women's Health, Heart for Excellence in Research and Education, and the 2019 Ellis Island Medal of Honor. Truly extraordinary, all of her awards and accomplishments. And without further ado, Dr. Roxana, welcome to Live with the Lowe's. It's such an honor to have you on our show tonight.
Thank you, Father Nicholas and Dr. Roxanne. What an incredible honor for me to be part of your program tonight.
Well, we are so blessed to have you. And let's get right to it, because I know that there's going to be a lot of people that are going to want to get the answers to some of these questions about the power of the human heart. One question we had is, as we continue to battle this COVID-19 pandemic, and yes, we're definitely seeing signs that we're getting out of this pandemic, but I just really wanted like to know is, what impact have you seen of COVID-19 on the heart and on patients' recovery?
So thank you for that question. Incredibly important question. And we have seen, as you know, the COVID-19 pandemic and the infection has affected not just the lungs, but also the cardiovascular system and the including the heart muscle as well as the arteries that are in our cardiovascular system. And we've seen increased clotting and even some very important increased bleeding episodes and things like this with the COVID-19 pandemic. We've also seen with the infection direct toxicity to the myocardium, which is the heart muscle, and obviously it's been some of the things that we've been looking at, inflammation around the heart, and in some cases it has stayed on as the long COVID syndrome in the heart.
Wow.
So, yes, the heart has been as one of the affected organs.
Incredible. And we know the pandemic has really contributed to increasing levels of stress, anxiety, insomnia, and
Mm-hmm.
of course, depression. And we know that our risk for heart disease does increase with depression and really the experience of chronic stress. What are you recommending to individuals to improve their mental and emotional wellness, to improve their cardiovascular health during this time?
Dr. Roxanne, thank you so much for bringing that up because often when we talk about heart disease, we're saying, well, the risk factors are high blood pressure, high blood sugar,
Mm-hmm.
smoking, a
Right.
sedentary lifestyle, and no one talks about the stress, the emotional stress, depression, anxiety, and all of those things that exorbitantly, in fact, affect women even more than men.
Mm.
And we have seen the effects of it present itself even as a broken heart syndrome, for example, which happens more often in women. We now know that stress and anxiety and the mental well-being of humans are associated with uh, heart related issues, and
Mm-hmm.
we absolutely have to pay attention to that. Now, how do you do this? How can you manage your stress? And that's the really, really big question. First, you have to make sure that you understand that um, having a lot of stress and anxiety does have an important relationship with heart disease, and
Mm-hmm.
managing it can actually help alleviate some of this. How much research do we have in this? We want to get more data on it, but we certainly know that there is a direct relationship and an important risk factor that
Mm-hmm.
is under recognized, under appreciated, which is stress and anxiety. And we absolutely must find some solace in some of our daily life, whether it's in meditation or prayer, or in some ways to reduce our stress levels. Incredibly
Mm-hmm.
important.
I mean, it's interesting that you speak about that. I mean, and in the tenets of our faith, they talk about the necessary Sabbath,
Mm-hmm.
and taking that time to protect the boundary with which we sort of contain that stress. And how many of us are not doing a good job respecting that because we work ourselves into the ground? But I'm kind of curious as to what exactly does happen to the heart in
Right.
stress.
Right.
Is it the increased heart rate? Is it the increased blood flow? Is it the release of cortisol? I mean, what exactly is happening to this very delicate piece of the soul that affects our body so much?
It's probably all of the above. And very importantly, is if you think about, the stress and anxiety then causing insomnia and kind of this really kind of a circular pattern that continues to feed upon itself, and really accentuated as you really don't stop to take a rest and to really think about that. Many of us are not sleeping the number of hours, for example, and there's been very, very good um, uh, data and analysis that basically have shown that if you're not getting enough sleep, enough downtime, you will have more risk of developing cardiovascular disease.
Mm-hmm.
Furthermore, those who have stress and anxiety, there could be poor eating habits, less exercise. All of those things could actually help alleviate stress. So some daily exercise, and obviously less eating, especially more healthy eating habits towards plant-based diets, and
Mm-hmm.
really reducing the fat intake in our body, and stopping your food at a certain time, like many hours, 4 or 5 hours before you sleep, is incredibly important so that you could get your best sleep, which is
Mm-hmm.
so important for the mind and the body.
You're listening to Live with the Lows. We're so honored to be joining tonight by Dr. Roxana Mehran, an amazing cardiologist, world-renowned cardiologist, who's joining us tonight for this special show as we are in February in Heart Healthy Month. If you'd love to talk to Dr. Roxana, please call us at 1-855 237 2346. That's 1 855 237 2346. You can also email us a question at ask@ancientfaith.com. That's ask@ancientfaith.com. And we love how there's so many people that are tuning in also on social media. If you'd like to ask us a question, please feel free to do so in the comment line. Building on what you were saying, Dr. Roxana, I love that question, Roxanne, that you were asking about what literally is happening to the heart. We're seeing all this, the increased heart rate, our blood pressure, our everything that is bad is happening during moments of stress. What are you seeing though what are the signs that we see on the heart or the impact on the heart for prolonged levels of stress? In other words, when you have a family member that's sick or is dying, or or maybe you yourself are dealing with something. Are we seeing something that we're seeing that's impacting the heart physically over prolonged periods?
Well, we believe that's the case. The research on that is limited, and we're really trying to do more and more on this. And as we're becoming more exposed to the fact that now we're seeing this broken heart syndrome where a patient comes in after a big argument or after a big stress or after grieving,
Mm-hmm.
and they come in and we think for sure it looks like a heart attack. You bring the patient to the operating room, to the angiographic suite. You do a coronary angiogram, and the arteries look clean, yet the heart has been blown out like a balloon, as if it has suffered a huge heart attack. And we call this the broken heart syndrome, and a lot of it associated with high levels of stress, and especially a certain incident that creates a tremendous accentuating
Mm.
circumstances of that. And we've seen the heart as the affected organ. And as we've learned about this, we're now trying to see, are there um, prolonged episodes of stress and anxiety, lack of sleep, lack of exercise, how they're all kind of feeding off each other and making a high inflammatory biomarkers that go up in the body,
Mm.
showing more inflammation around the heart, and then associated with heart attacks and cardiac events, unfortunately.
I mean, that's incredible. So the validity of the broken heart syndrome is very real. Even without blocked arteries, we can have a temporarily enlarged heart and one that is not pumping as well. And you talk about these sort of inflammatory markers. What are these inflammatory markers? If there's so many people right now. I can tell you just in the last week, I've spoken to somebody, dealing with sexual abuse, somebody whose mother is dying, somebody whose brother just got hit by a car, somebody whose husband just left her, and she's, somebody whose husband just passed away. It's chronic, in depth, like a dark stress that people are having a very hard time. The body is physiologically challenged to even hold the intensity of the emotion that they
Mm-hmm.
experience. And, part of us, in those circumstances want to almost allow that intensity to just flow. And we sometimes forget that the body needs a rest, needs a break because of this sort of inflammation that sounds like it's very real. What are some of the inflammatory markers that we could check to see, like, how are we actually managing this stress?
Well, the one that is most commonly looked at is the C-reactive protein, which is a biomarker that goes up during the times of inflammation, if there is inflammation in the body. But it also goes up, it's non-specific, so it does go up when you're having, let's say, a viral infection or a bacterial infection as well, if there's an
Mhm.
infection going on.
Okay.
But when absolutely you have no fever, nothing is going on, and then you measure these biomarkers, and we
Mm-hmm.
start to see an elevation, you start to get more concerned. Are you stressed? Are you and the other part is the cardiometabolic fitness. So if you have abdominal obesity, we know that that's also associated with more inflammation, and inflammatory biomarkers do go up when
Mm-hmm.
there is fat around the organs, especially around the abdomen. So, uh, so much of everything is sort of feeding off of each other. And of course, the psychosocial stress is one that is really unmeasurable and very, very difficult to note. But we've seen um, men and women who are stressed to the max, who experience these losses or stressful situations, have a fluctuation of their biomarkers going up and down based on these things. How much of that research is well substantiated? It's not as well documented as it should be. It's difficult to do, but this is what we need to do going into the future of our
Hmm.
clinical trials, to better understand and associate and figure out how is it that stress is causing this important organ damage. How much of it is by making the plaque angry that's in the heart already, or how much of it is affecting the heart muscle in it of itself.
Mm.
So there is both on both sides, both in the plaque that could be in the artery, laying dormant, inflammation, making that plaque angry like a volcanic eruption,
Mm.
and having it sort of rupture and form a clot, which we see in a regular heart attack, which is most often seen, or with completely clean arteries, where there is an effect directly on to the heart muscle, where it just blows out, like it just gives up and becomes what we call a broken heart.
It's interesting too, as you're, here when we began the show, we started sharing some Bible verses that are from the book of Proverbs, written, 2,500 years ago, and how significant they were talking about how to guard the heart, for everything flows from it. And, that's before they had any access to the level of technology that we have now. And what we're seeing is just not only spiritually, but also physiologically, how impactful stress, worry, fears are impacting the heart, and unfortunately are helping with heart disease. I mean, we're seeing an obvious correlation between our mental health and heart disease, and it's just
And how the spiritual health can come in and sort of help mediate this sort of correlation
exactly.
that we're seeing, which is incredible. We have a emailer that just wrote in saying, "Gosh, this really scares me. Billy Graham's healthy daughter just had 2 heart attacks recently. She's in her late 40s, early 50s, and this seems to have been out of the blue. And we know that heart disease is the leading cause of death among women, and one of the most preventable. I mean, how can women control their risk of developing heart disease?"
Mm-hmm.
Really, really important question. And we're seeing now that the statistics on heart disease in women are daunting. The decline in the prevalence of heart disease is slowing down, meaning that in fact, in our own country, in US and Canada, we're seeing more and more younger women presenting with acute coronary syndromes, which is like heart attacks, and we're seeing that, and a lot of it in the younger age. So how can we handle this? And one of the things that we just did in this year, I was commissioned by the Lancet as the lead commissioner to look at all of the global burden of cardiovascular disease in women around the globe and come up with what are the gaps for women, and then give the top 10 recommendations to reduce the global burden of disease in women
Mm.
for cardiovascular disease. And so we made the recommendations, and the one of the top ones is in recognizing some of these important risk factors and educating our women and including them in our clinical studies and in clinical trials. Women are underrepresented on their their they're underappreciated and underdiagnosed, undertreated for heart
Mm.
disease. And we're seeing statistics go in the wrong direction. And in fact, the awareness of heart disease as the number one cause of death in women has declined over the last decade. So we were more informed in 2009 than we were in 2019 for heart disease being the number one cause of death in women, which makes
Mm.
no sense because we try to talk about this, especially during Heart Month, and yet people are not paying attention to it. And so we must find a new way to make sure that our voices are heard for all women to not to think about heart disease as an old woman's disease, but rather begin from
Right.
the time of
Mm-hmm.
inception for
Mm-hmm.
intervention for women, for young girls in their sedentary life and lack of exercise and too much tablet time and not enough of communication and having enough time with loved ones because we're just all connected to our screens,
Mm-hmm.
and the use of e-cigarettes in the young adolescent girls now,
Mm-hmm.
and really pushing towards pregnancy related complications in women that have a clear association with heart disease down the line. So
Wow.
That's
we
incredible.
shouldn't be cardiologists should be not be seeing women when they're after their menopause for the first time, but we have every opportunity to intervene from the time a woman is born until they leave this earth, to
Mm.
intervene. It's never too late and it's never too early.
I love what the light that you're shining and sort of illuminating this for women, because a lot of times you hear this is either something that happens to somebody who's older, or this is a
Right.
male
Right.
issue. And we have an email question that just came in. She writes, realizing that everyone is different, when the three of you are together, all three professionals together on air, what would a healthy day look like to you in terms of a daily routine that would keep the heart healthy? I'll let you begin that, Dr. Mehran.
Yeah, so let me tell you, I think, and I prescribe this to a lot of my patients, is to wake up and to have a moment of peace, spiritual time for yourself and yourself alone, and with your own spiritual, whatever is your faith, your religion, your ability to find the peace within yourself with the Almighty. For me, it's
Mm.
incredibly important, that time, the solace time. So now, not everyone is doing that, but I think to me, it's incredibly important. And then I think um, really planning your day in a way that has some exercise, good eating habits, time for yourself, time for your work, and time for your loved ones. And making sure that you take a break from your screen time, walk around, make sure that you talk to people and communicate with loved ones. Those are all the things that bring joy to your life, that help you handle the stress and the issues in your own life. Anything that will reduce the stress, and of course, right now we're in a very difficult time, right? Many people have lost their jobs, are making
Mm-hmm.
less money, prices are going up, grocery bills are higher, heating bills are higher. All of those things bring stress. So we have to find a place to find some of the solitude.
I
I
love
would
that moment of
also
peace.
say
That's
that
beautiful.
the peace and solitude, I give that. I would also say that if you don't know about your risk factors and your numbers, you should know what those are. You
Mm.
should be educated about your body, and you should ask questions and make sure that you're not just left to yourself and say, oh, I'll handle this, there's nothing wrong. Especially women, they ignore a lot of their symptoms. If you're having symptoms, go to the doctor and ask the questions and make sure that you're getting the attention that you deserve. Sometimes even I see that physicians are seeing you, but they're sitting behind their computer and really typing on their screen, and they don't even pay attention and make
Mm.
the eye contact and the
Mm-hmm.
important patient doctor relationship that's incredibly important.
I
Ask
mean,
for that and you'll get it.
what are these symptoms that we would be looking out for? I mean, you hear the traditional shortness of breath, but how do we know if the arteries are blocked? It seems like, sometimes it's the widowmaker, the silent killer. I see people writing in Facebook. How do we actually know
Mm-hmm.
outside the signal of an occasional shortness of breath?
Yeah, so first of all, I think there are important things when I say that you should know your numbers. It means you should know what is your blood pressure. So that means you have to have your, because that's a silent killer. Not knowing your blood pressure, you could just have a, very high blood pressure and not know it and not have any symptoms of it. And if it's long enough and lasts long enough, it will have important implications on heart disease. Heart muscle will be affected. It's a risk factor for blocked arteries, and it's a risk factor for atrial fibrillation, which is an abnormal rhythm. It's a risk factor for stroke. So hypertension is the lowest hanging fruit. So you should know your number. Everyone should know what their blood pressure runs. And it's not just one measurement, it's a measurement that you would have to take on a daily basis for a week just to know what is your blood pressure.
Okay.
You should know your cholesterol numbers. You should know what is your LDL, which is the bad cholesterol, and your HDL, which is the good cholesterol. Because if you have a low HDL and a high LDL, you really are at some risk. So these are some of the important things. And then we get to the symptoms. Obviously, shortness of breath, chest pain, um, inability to sleep flat and need to get air because you just can't sleep flat, swelling of the legs, all of those things could be heart symptoms. But, we also know that women may have a heart attack by having very non-traditional um, symptoms. They may not get the chest pain or the shortness of breath. They might just feel fatigued, which is a very non-specific thing, right? So they can have other things like nausea or fatigue or tooth pain. I remember one of the things that happened to me when I was a medical student. I saw a woman who had 4 of her molars removed because she was having tooth pain, but actually she had a blocked artery. And it
Oh, my
wasn't, it
goodness.
was just an abnormal, it was a different kind of, so we call them atypical. We want to stop calling them atypical. They're just not traditional and not the kinds of things. So you have to pay attention when you're not feeling right and get evaluated.
Absolutely. This evening, we are speaking to Dr. Roxana Mehran. If you would like to ask her a question, she is tonight speaking about the heart and the importance of the health of the heart on our soul and our emotional well-being and vice versa. If you would like to ask a question, you can give us a call throughout the show at 1-855-237-2346. You can also email us, as several emails I can see coming in, at ask@ancientfaith.com. And we're also broadcasting live on Facebook. Welcome to all of you there. We see you all in the chat room. If you have a question, feel free to state one there. So this is the biggest question I think that probably happens for a lot of people in that they have this strong family history of heart disease. And then maybe they're dealing with depression in today's world. And we know that depression can almost be as big of a risk factor as smoking, cholesterol, and blood pressure. And when you look at the sort of risk of lifestyle versus, the genetic potential that you come in with your family history, what's more important there? And are we doomed if we have sort of a family history of heart disease or high cholesterol?
Yeah, I think it's one of the risk factors, right? And so, of course, if you have a family member who suffered a heart event, whether it's a stroke,
Looks like you might be.
that.
Oh, there she is.
You
Okay,
need to
sorry, we lost you
evaluate
for a
that.
second.
I'm sorry. I'm so sorry. So if there is a family member who's had any kind of a heart event before the age of 60, that family member, you then have a family history of heart disease at an early age. And that is a risk factor for you as well because of the genetic predisposition for heart disease. So family history is quite important. And if you have a family history or any other risk factor, you have to be extra vigilant about your heart evaluation of your heart status. And so, I think that, in other words, looking at your other risk factors, knowing your numbers, as I said, your
Mm-hmm.
blood pressure, your cholesterol, your glucose level, especially because diabetes is such an important risk factor as well.
Dr. Roxana, are there certain ethnicities that you're seeing that are more vulnerable to heart disease than others?
I mean, I think one of the things that we are seeing is worsening outcomes on all of the uh, socio-demographic factors. We've
Mm-hmm.
seen that a lot. In other words, we see that the minority status, low educational status, low income, all of this is associated with worsening and higher incidences of death
Mm-hmm.
with heart disease. And a lot of this has to do with access to care, access to good food, probably higher stress and anxiety for this group
Mm-hmm.
because of their deprivation from their socioeconomic status. And I think those are all very, very important determinants of health that we now are paying a lot of attention to.
Mm-hmm. Yeah, I know that one of the things that we wanted to kind of address with you is that a recent analysis has shown that disparities in cardiovascular risk factors between Black and white adults in the United States, disparities that may be largely attributable to social determinants of health. And I guess let's talk a little bit about this, but also how do we bridge this disparity gap?
I mean, I think it's one of the most important questions for us here in the
Mm-hmm.
United States. That gap exists. It's hard to believe. This is not just in the developing world. So,
Mm-hmm.
we must give and be open and share what we have with our neighbors, right?
Mm-hmm.
And whether whoever they are, whatever is their race and ethnicity, and we have to do whatever it takes to make sure that each and every human has access to healthcare. How
Mm-hmm.
do we accomplish that? That's the very, very big question. And I think a lot of it has to do with more peace, less war, and spending all of our dollars and economic wealth on health and access to care. And if
Mm-hmm.
we could do that, it would be a much better world. And I hope that we could get
Right.
there somehow.
Right, and I'm sure in your research that you're seeing that so much of this, to be quite honest with you, it's preventable. I mean, it's things that if people did have access to proper and appropriate health care with appropriate levels of nutritious food that would be available at an appropriate price, I think people would be. I mean, I think that maybe we would see, and maybe I'm just being naive about this, but it seems that a lot of what we're doing is that are contributing to are contributing to the problem that we're facing. And it seems if we were to be much more aware of how we can contribute to helping those who do not have access to proper and appropriate health care, that we really would be a society that would actually be our brother's keeper, that we would yearn to help make a difference in people's lives, especially those who may not have access to the things that we do.
So
Absolutely. I couldn't
we
have
have
said it
another-
better myself.
we have another couple of, okay. Looks like we have a call. If we can go to the phone lines. Caller, are you there?
Yes.
Welcome to the Live with the Lows.
Yes, thank you so much. I had a question for the doctor. I am a cancer and stroke patient, and I received the Moderna vaccine with the recommendation of 3 of my primary doctors because of my history. However, once I received the vaccine within 25 minutes, I had severe reaction to. I had numbness in the hands, feet, and face, atrial fibrillation, just a whole series of irregular heart rhythms, chest pain, and later on I developed severe fatigue, nausea, which included even fainting. However, and I was referred to a cardiologist. However, the cardiologist, in spite of all my explanations, does not seem to feel that the symptoms that I have are connected to the Moderna vaccine, where before I didn't have these symptoms, not to the severity that that I had it immediately after the vaccine. So because he feels that it's not connected to the Moderna vaccine, he's treating it with Bistolic, the prescription medication, which treats high blood pressure. But I never had high blood pressure. And he actually, another medication that he prescribed was an antidepressant, which I don't feel that the symptoms that I have, because they wake me up, even the pain, the chest pain wakes me up at night. He still doesn't feel it's related to the Moderna vaccine and any heart problems that could be affected by
is your question, how does that Moderna vaccine, did it contribute to what you were experiencing with your health afterwards?
Oh, absolutely. Absolutely.
Okay.
What are you seeing, Dr. Mehran, in terms of the vaccine's connection to heart health?
Well, I mean, I think what we have to do, and I think all physicians and clinicians have to do, in what are some of the related and related side effects of these vaccines. There are very, very rare, extremely rare side effects that could describe some of your symptoms, and you could be convinced of that. But having a high blood pressure just after the Moderna vaccine as a new finding is extremely rare, almost not really associated. So it is interesting that you're having that. I'm not denying that it may or may not be related to the Moderna vaccine, but whatever it is, I can tell you that the benefit of the vaccines far outweigh the risks that they have in preventing the catastrophe that we've all have felt again, and the numbers of deaths that we have experienced with the COVID-19. And without the vaccines, we would be not in a very good place at all. And certainly, there is some rare side effects of these vaccines that are extremely rare. But I'm not denying that your symptoms are not related. They could be
Right.
related. I don't know you as my patient, but it is important to get a full evaluation. Nonetheless, if you have high blood pressure, you certainly should be treated with medications, whatever the doctor sees fit for your condition. Regarding your depression, for antidepressant, I'm not certain. That again is another evaluation of making sure. Of course, many of us are feeling the symptoms and the syndromes of depression and anxiety. So, some are treated medically, some are treated by just having peaceful time and meditation and, spiritual, finding your spiritual solitude to make it better. But I can't say, because you're not my patient, I can't say on the
Right.
phone what I think you have, unfortunately. But thank you for your question.
Mhm.
Yes, thanks so much, caller, for calling in, and we appreciate it. And just like the caller did, you can call in and join us on Live with the Lows. You can call in at 1-855-237-2346. That's 1-855-237-2346. You can also email us a question at ask@ancientfaith.com. That's ask@ancientfaith.com. We're going to take a quick break. On the other side of this break, we're going to ask Dr. Mehran, really, if heart disease and high cholesterol runs in our family, what are the preventative measures that we can all do right now to save our heart? So stay right with us right here on Live with the Lows.
Live with the Lows with Father Nick and Dr. Roxanne will be back in a moment. Give them a call at 855-237-2346. That's 855-AF-RADIO. They would love to hear from you.
Are you struggling in your walk with Christ? Do you want to rediscover your reason for living, the person you were created to be? Renewing You, a priest, a psychologist, and a plan gives you the keys to unlock areas of your life that hold you back from fully experiencing the renewal and transformation God has in mind for you. Co-authored by a priest and a psychologist, Father Nicholas and Dr. Roxanne Lowe, Renewing You combines principles of spiritual growth with psychological tools to help you become your best self, fully connected with God's purpose for you. To purchase this book, please go to store.ancientfaith.com. That's store.ancientfaith.com.
We're back with Live with the Lows and Father Nick and Dr. Roxanne. Do you have a question for the Lows? Call in now at 855-237-2346. That's 855-AF-RADIO. Here once again is Father Nick and Dr. Roxanne.
Well, welcome back, everyone, to Live with the Lows, and thank you so much for joining us on this Tuesday evening. Before we get back to our amazing conversation with Dr. Mehran, just allow us just to once again remind you to join our daily inspirational messages. You can go right now, actually, during our show to thelows.com. That's LOUHS.com. Click on that subscribe button, and tomorrow morning you will receive a daily word of encouragement. We also, as we're approaching the season of Great Lent, a couple of just real quick announcements. One is that on next Tuesday's show, we're going to have Dr. James Skadros, who's a professor at Harvard, as well as at our Holy Cross Greek Orthodox School of Theology. Going to talk about something truly amazing. And if you've never studied the history of why we have Great Lent, how did that all begin? You don't want to miss next Tuesday's show, again, right here on Live with the Lows.
So, Dr. Mehran, we had another question come in. Actually, we had two. I'm going to sort of combine them in a question. The question says, did Dr. Mehran find that numbness in the hands or feet, is it found to be heart-related or a neuromuscular issue?
Usually numbness is in the hands and feet are usually a nerve or peripheral neuropathy issue, but there could be sometimes you can get where you have heart symptoms that is associated with numbness on the left side or even especially in the arm and up in the chest or up into the neck could be there could be some numbness associated with heart symptoms as well.
And let's talk about plant-based eating. Lent for Greek Orthodox Christians is right around the corner, and we know that, fasting has a number of spiritual benefits and is used as a tool and a tenet of our faith. But I'm really curious, oftentimes what is good for us spiritually tends to affect us physically. I find God's design in the body and our spirit is just profound wisdom that you can't even explain. And so I'm sort of curious, what are the trends with plant-based eating and the role of nutrition as it really relates to our heart health? What are you seeing amongst heart health patients?
Well, we're seeing extraordinary effects with plant-based diets where, there's a huge improvement in obviously the body mass index, reduction of the abdominal obesity, reduction of fat around the organs, and improvement in health outcomes of patients who are on Mediterranean diets and plant-based diets. This is a well-known fact and a well established data now that have shown better longevity with a plant-based or Mediterranean diet.
So that is definitely something to continue well beyond Great Lent. And let's talk a little bit about the major risk factors for developing heart failure over our lifetime. Does heart failure present differently in women? And what are we setting ourselves up for in terms of heart failure? What contributes?
So, heart failure obviously can be presenting with different symptoms and symptomatology in men and women. And very important is that it could be going on, especially in women who don't.
Mm.
Looks like
Seems like we might have lost.
Had a bad connection there. Oh, there you are,
Sorry,
Dr. Mehran.
sorry
It went
again.
out.
Sorry again. And when I'm on the phone, and unfortunately, and if someone tries to call me,
You're a
get
No
cut
popular
off,
problem.
so I
woman.
apologize. I apologize. But I think heart failure very, very important. One of the biggest sort of issues, and unfortunately the poor outcome. So when you have heart failure, sometimes it could be from blocked arteries, causing heart attacks that are silent, that then continue to what we call ischemic cardiomyopathy, or a heart muscle that's weak due to the fact that it's under a lot of ischemia, not enough blood supply. There are
Mm-hmm.
others that has to do with what we call high blood pressure or diastolic heart failure, which happens more often in women, where we're
Mm.
seeing not that the heart is billowing out, but rather thickening and not contracting well. And that we're seeing in women. All of these are associated with a bad outcome, especially if the pressures inside of the heart are elevated and backing up into the lungs, into the right side of the heart, onto the liver, down to the legs. And so, very, very important is in understanding what causes the heart failure, what's the reason for the heart muscle not working well, and treating the underlying cause.
Mm-hmm.
And then, of course, after that, one can evaluate that and hopefully get the best possible treatments. We now have amazing drugs that help prolong the life of patients with heart failure. So it's really, really important to have those evaluations and then get treated accordingly, whether it's diuretics, beta blockers, ACE inhibitors, um, ARBs, ARNIs, all of these different drug types that now have become available, and the newer agents that are diabetes drugs that seem to be helping with heart failure seem to all be tremendously effective in treating patients with heart failure. So very important to make that diagnosis.
Okay.
Dr. Roxana, when you look at the last 10 to 15, really the last 20 years in our society, we're seeing the amount of hours that people are working has increased. The amount of vacation has decreased. We see increased levels of stress on almost every level. This is obviously pre-COVID. And now that we're in a COVID season, as we've been over the last 2.5 years now, are we seeing increased levels of heart disease over the last 10 to 15 years? And if so, would you attribute that to the additional level of stress that we're seeing? In other words, if you're comparing the last 10 or 15 years to the previous 10 or 15 years, are we seeing those numbers increased?
Well, it's hard to have an accurate answer to this very, very difficult question that you're asking, because if I were to say, what I would say is that we're not seeing the decrease we should be seeing.
Mm-hmm.
In other words, the decline in heart disease is not what we are seeing. And we continue decade after decade to have the heart disease be the number one killer of men and women around the globe.
Mm.
And we're not seeing that decline as we would like to see it, despite all of the great therapies we have available. So, what is that due to? If we have the best possible surgeries and
Mm-hmm.
angioplasties and stenting
Mm-hmm.
and best medications, why are we seeing that we're not making a dent
Right.
in this
Right.
important issue? And is it that our stress level, our depression and anxiety, and all this other um, issues continue, and climate change and pollution, air pollution, are these all now contributing to heart disease in a way that we can't even measure it, that even the best possible therapies are not helping,
Mm-hmm.
because we're constantly thinking about diabetes and hypertension and obesity, and not thinking about stress, air pollution, anxiety, depression, socioeconomic deprivation, low
Mm-hmm.
education status, lack of access to healthcare as the important way of addressing this important issue.
Mm-hmm.
This is what is very fascinating and subject of future research.
I hope so. Yeah, I'm very fascinated by it as well. And we obviously, on our show do a lot of discussions about stress and fear and worries, and we talk about how they impact us spiritually. And that's why we felt this show to be so important, because we wanted to kind of highlight a show that would really focus in on how all of this stuff is physically impacting us, and it kind of cascades. I mean, you look at how all of these things impact us spiritually and emotionally, but we're also seeing how it cascades into us physically, and then that in turn keeps us down. It keeps us unwilling to want to get up. We eat comfort food. We don't focus in on things that are
vicious cycle.
We kind of stay stagnant where we are, and so it is a vicious cycle. Exactly, Roxanne.
I mean, the importance of caring for the heart, which is the deepest seat of our soul. I mean, I think from a mind standpoint, from a physiological standpoint, God intended this for good. To fulfill our purpose, we need to stay alive. In terms of self-care, I know a lot of people think, well, this is selfish, to take care of myself, to reflect so much on myself, but really to do that is much selfless, right? Because we are able to fulfill that greater purpose of being on this earth and what we were called to do. And so, Dr. Mehran, I want to get to this one last email question that did come in, because I think this probably touches the heart of many. But she writes in and she says, I tend to be an anxious person. I'm a high stress person. I work a lot. I'm a taskmaster, but I seem to always be, worried or stressed about something. And she said, once a month, I get a racing heart. And she said, I don't know what that is or what it means. It doesn't feel like a panic attack, so to speak, but it just feels like my heart is racing faster than I can breathe. And it takes me time and prayer and meditation to calm down. And she wants to know, is this something I should be concerned about?
Yeah, I mean, I think anytime you have that kind of stress and anxiety, there is something to be concerned about, and you should do something about it. And talk to someone and have some spiritual counseling. And all of that will help you get better.
Yeah, I think, one of the things that it's so important for anyone that's listening to our show is how intentional we must be, that sometimes, because we can't see under the skin, we just simply look at how we feel, and we kind of operate our life with what we can actually just simply feel. And then sometimes, as we've been talking about, this silent killer impacts us. And so if there's one theme that I think that you've been getting across to all of us, Dr. Roxana, is the importance of being intentional in what we are doing and taking care of our heart, how we live our life, taking the time to
know our numbers,
everything that requires our level of work. And God knows that's very much part of a Christian tenet of our faith, that faith without works is a dead faith. And so I want to thank you so much, Dr. Roxana, for your time. I know you're so busy, all the different fields of study that you were in, it just amazes us. And for you to take the time with us, we're just so very grateful. So thank you so much again for being with us. And please give our love to Dr. George and to your family.
Thank you both for having me.
Absolutely. It's our pleasure. So in these final moments, I just wanted to kind of give all of you a word of encouragement. We're only a couple of weeks away from Great Lent. And as I mentioned earlier, Dr. James Skadros, who's a Harvard professor and also a dear friend of ours, and also a professor at Holy Cross Greek Orthodox School of Theology, will be with us next Tuesday to talk about the history of Great Lent. And as we're approaching Great Lent, I don't know if many of you may know this or not, but we're in the sacred season of what is called the Triodion period. It's almost this several weeks of just the church giving us an opportunity to kind of get into the shallow end of a pool before we dive deep into the season of Great Lent. And every Sunday has a specific theme that's attached to it. And I just encourage all of you that this Triodion period, it literally means 3 odes. It's basically 3 Sundays with 4 weeks between them. My prayer for all of you is that it also allows us not to just focus on the themes of that Sunday, which are themes that we all need to be a part of and that we need to make part of the core of who we are, whether it be humility, whether it be trusting in God. But I do want to encourage all of you that in this season prior to Great Lent, that we take a moment to just simply look at how we can listen to God. We're living in a world, friends, that's so busy. And I think Dr. Roxana was mentioning this so beautifully earlier, that we're living in such a world where we're being pushed and pulled in so many different directions. And my prayer for all of you is that Lent would give you some time to slow the pace and to create some space for God in your life, to simply slow the pace in how you're living your life. And that the quieter you become, the louder that we'll be able to hear God speak to us. Because we're firm believers, Roxanne and I both are firm believers, that God doesn't have a speaking problem, friends, but oftentimes we do have a hearing problem. So let's take this time over the next several weeks as we're ushering in Great Lent to just take time to slow the pace and to create some space for God. We want to thank Matushka Trudy for producing our show. As always, she does a great job, and all the great people at Ancient Faith. We also want to encourage you that if you're looking for some renewal, check out our book, Renewing You, a Priest, a Psychologist, and a Plan, that you can find right here on Ancient Faith by going to store.ancientfaith.com, as well as always checking out our daily inspirational messages by subscribing to them by going to thelows.com. That's LOUHS.com. Once again, everyone, God bless you and stay strong in your walk of faith.
Father Nick and Dr. Roxanne are the authors of the book Renewing You, a Priest, a Psychologist, and a Plan, which can be purchased at store.ancientfaith.com. Their daily inspirational messages can be found at thelows.com/subscribe. Be sure also to search for The Lows on Facebook, Twitter, Instagram, and YouTube. Live with the Lows is a listener-supported presentation of Ancient Faith Radio.
Ancient Faith Radio presents Speaking the Truth in Love with Father Thomas Hopko. Father Thomas is the Dean Emeritus of St. Vladimir's Orthodox Seminary and the author of numerous books and articles. From his study in Elwood City, Pennsylvania, here is Father Tom.
In the Orthodox Church, we just celebrated the festival of the Holy Angels. That's the way we speak about it generally. And we know the names of some of those archangels: Gabriel, Michael, Raphael,